So good morning, good afternoon, good evening, guys, depending on where you're watching this video from. My name is Zippy the Nurse on YouTube, on Facebook, on Instagram, on TikTok. That is what I go by. Call me. The emails that you guys send, the comments on the comment section, the interaction that we've had in the last 1 year, it has been so okay, and I thank God because of giving me such a family. For the negative critics, for the positive critics, they're all welcome. At the end of the day, no man is an island. And then there's another thing I normally say: every day we learn, especially in medicine. Medicine is so dynamic. I'm sure there's some people who normally see out there and they're like, wow, this girl, she's come from far. Anyway, let's go direct into the video and let me talk about what I want to talk about today.
Yes, completely, and talk about our mental health. I really like talking about mental health because at some point I think I was breaking down mentally, but I didn't know. I've gone through things in life that broke me down emotionally. Then I ended up taking routes that were not fit for my health. I ended up taking routes that were not fit for my physical health, emotional health, uh, financial health. Name all aspects of health status that you would want to talk about. Guys, when somebody behaving the way they are behaving, please do not judge them. And I think I've said this thing so many times. I've said it so many times. Don't judge people according to what they are doing, you know. And then you might find like today I'm okay. When I was growing up, I used to see people who are doing so well in life. Then later on, you find them in the streets. You wonder what happened. Little did I know that mental health is very important. So why am I talking about this thing? I just thought it's important for us to talk about alcoholism. There's a friend of mine who's a nurse in Australia, and she's a mental health nurse by the name Marie. Maria, this is your video. You need to enlighten us more about mental health. When I was opening up this channel, I was telling people I want to be an example to people so that they learn. So here comes the story of Zippy. Zippy is a pastor at some point. She's a very good girl, but then she gets into a company of people who are drinkers. Zippy has never seen alcohol, but these people tell Zippy, hey, yo, you know what? You're losing. Drink, onja kadogo. Zippy bwagas moja, mbili, tatu. And she's like, wow, you feel euphoric, nini, you feel nice. Then you start indulging in alcohol. What is that? That is peer pressure. A lot of you people right now found yourselves in the company of people drinking because that was peer pressure. You indulged in that, and then it became something which is like it's a norm to you. Okay? Other people get into alcoholism or get into those weird behaviors in terms of like maybe you are stressed out. There were some things that were stressing you, either emotionally, physically. Then you just feel like you want to drown yourself in alcohol so that you forget what you're going through. That is also another thing. The things that we are going through. Okay. I went through there are sometimes back in my life I went through some separations in life, like separating with my kids, those people. I've lost two brothers along the journey. And then it became so bad for me that I felt like I don't even need to live as well. I am not worth it living. Some sickness, like of recent, I saw a guy I was reading on, I think it was aired on NTV. There's this guy who has had a sickle cell for a very long time, and then he's finding himself unfit to be in the society because he deems himself as unworthy. I mean, he feels like he's not important in the society. He's not productive, so he just feels like, why can't the doctors in Kenya help him perform euthanasia? Like he wants to die, but he doesn't want to commit suicide. He's not into drugs, yes, but he's just looking for a way, for a hospital that can help him kill him. You guys, you're a medics, you know what is euthanasia, right? So he's looking for somebody, like, it's illegal in Kenya, and then he wants somebody to assist him in dying. He doesn't want to kill himself, he doesn't want to commit suicide. So what I'm saying is there are some conditions that lead us to doing things that we do. You've gone through a lot of suffering, you've gone through a divorce, you've gone through a separation, you've gone through grieving, peer pressure, and then you find yourself indulging in what you're doing. Then without noticing it, you become addicted. You end up becoming an alcoholic. So many a times we find ourselves starting with alcohol. Alcohol is the most abused drug in the world. Because I mean, if I have 200 and I get into a place like in the dens, like huko kwa slums and stuff, Naenda nichukue kanudhu. Nikichukua kanudhu nitachapa hivi na nitakuwa tu sawa. Let me talk about Uganda. You know, in Uganda, there was something they used to call waraji. Small alcohol. I think it's China. And you know, it's 40% alcohol. You're able to get drunk, my friend. You feel euphoric and you feel like the world is just coming to you're flying, you know. So availability of this thing, that is also another factor. So within no time, you realize that you're already addicted. Within no time, you can't even control yourself. You're not able to inhibit. You have no inhibition factor. Your brain does not have that inhibition factor. Your brain cannot tell you now you need to stop and go home. Your brain cannot tell you that you need to stop now and eat something. Your brain cannot tell you that, Zippy, this is what you're doing and it's wrong. You need to stop there. If maybe you're fighting with someone, your brain cannot tell you to stop. We've had incidences of people who go to a bar, this posh, like Kilimani, Kileleshwa, they enter into a bar, then they start drinking, anaitisha pombe ya 300,000, and then kidogo anashindwa. Inhibitory factor is no longer there because it has been preoccupied with alcohol. So you cannot tell yourself, I need to stop and go home because I don't have money anymore. So you end up in debt, you know. So that is why I decided, let me talk about it, because especially this thing is very common in medicine. I'm sorry guys, but I have to say it. We are also human beings. We go through a lot in hospitals. Maybe somebody didn't want to become a nurse, somebody didn't want to become a doctor, but they were forced by their parents, because the parents know when you do medicine, you'll get money, you'll get jobs easily in the market, right? So what happened? You're told, just go and do medicine. Then you end up feeling so stressed. You don't even know what is going on. Yani, you can't even fathom you working in a hospital, working in theater, operating people. Like I remember myself when I was a PTS, we went for our clinical experience, and what I saw, my good Lord, you are amputating, my friend, amputating mguu, yani mguu inakata, and it's my first time. My friend, there is somebody even who fainted in theater. I mean, the things that we see. So you see, the things you're seeing within a short period of time, your brain is not able to comprehend all this, and it's not able to absorb. So what happens? You start indulging in these small bad behaviors. Within no time, you're already addicted. So let's talk about alcoholism. What is this alcoholism that we're talking about? It's a chronic disease in which a person craves. I'll be referring to my notes here. It's a chronic disease in which a person craves drinks that contain alcohol and is unable to control his or her drinking. You feel like leo aki lazima leo nichape ka Guinness kamoja. Leo lazima aki nichape white cup. Leo lazima aki nikitoka job mimi nataka tu Guinness ngapi? Mbili. Without noticing, you're already addicted. You've seen people you're working with them, they come to work in the morning but they're already drunk. So huyu mtu anajua kabisa anafaa kuwa job kesho. They know they're supposed to be working tomorrow. But at the end of the day, they have no inhibitory factor in their brain to tell them, because you're going to work, don't drink. Even if you want to drink, just drink one and go home, prepare yourself, come back to work. They don't have that inhibitory factor. Okay? So you find that this person, there is inability to control drinking due to both a physical or an emotional dependence on alcohol. These symptoms normally include, unapata msee akona repeated alcohol consumption. You drink today, you tell yourself you not drink tomorrow, but you find yourself again tomorrow you've drank, the other tomorrow you've drank, like the whole week manze you've been drinking. So now hapo unajua you're already addicted to alcohol and you are now an alcoholic. You can't tell us you're drinking socially. How does it affect you? How does it affect your mental health? It affects you because at some point you find that you're not able to reason. Unakuja kazi uko mlevi, you're supposed to give people injections. How will you be able to give injections? You see, it has inhibited your thinking capacity. You're not okay. You're not able to perform. You need to take, unafaa uchape kanudhu ndio tena ujipate you're able to perform. You start getting alcohol withdrawal syndromes. So what are these 5 causes of alcoholism? There are some biological factors. Research has shown a close link between alcoholism and biological factors, particularly genetic and physiology. Actually, let me tell you guys, there's a way they used to say, especially when you were back in the village, you find that somebody is named after their behavior. Like during the old damn days, you find that somebody is named after a name, like given a name, depending on how they behave. I think it's so common in Kalenjin area. You find that if you are born during the day, there's a name that they give you. Even as in our culture, you find like now me, I'm Gishohi. Gishohi is beer. But it's not that I was named after my behavior. I mean, that is my surname, and my dad is not even an alcoholic. But maybe the person who was hapo nyuma yake, the person who was named that name, maybe he was an alcoholic, I don't know. So you find that some genetics, unapata kwa familia there is somebody, yani tu lazima kuna mtu mlevi kwa familia yenu. Sasa pia wewe ikikuangukia hizo genetics, hizo genes zikikuangukia, my friend, you're doomed. That is just a biological, or maybe it's something that you can't control yourself. You just find yourself doing it, okay? Environmental factors like we've explained. Unajipata yani situation yenye uko ziko available kama Uganda. My friend, you just get out of that place, you have 500 shillings and you're feeling stressed out, you find people drinking and then you just give me environment. Yani it's readily available. Social factors. You go with a group of people who are drinkers and then they tell you, we onja mbili, onja tatu, we ndakubaia. You know, especially alcohol. Those guys just love themselves. They would rather not buy you food. They would rather you sleep hungry, but they'll buy you alcohol. Social gatherings. Okay, peer pressure, high level of stress, like I had mentioned, family history with alcohol addiction, and then drinking at an early age. Me, I used to hear people saying that they started drinking at when they were in Form 2s, they were in Form 1. And I'm like, Jesus, how did you even start that? How did you even know? I don't even drink socially. I can even go to a social place and I will drink my mocktails and stuff the whole night or even the whole morning, the whole entire time, but I will not drink. I will not even feel the urge to drink. Even if you people are drinking, I'll not even envy you. The following day, I'll wake up very sober and very okay. Let's talk about the 3 effects of alcoholism. Just 3. We will not deal on so much because, of course, there are so many others. 1, you might end up developing heart disease. Guys, stop drinking. You might end up developing high blood pressure. You might end up developing stroke. You might end up developing liver disease and digestive problems. Cancer of the breast can come, mouth, throat, esophagus, voice box, liver, colon, and rectum, weakening of the immune system, increasing the chances of getting sick. But let's not dwell on all that. Let's dwell on 1, digestive problems. So you've woken up today, you feel like your tummy does not want to eat anything because at the end of the day, you've been drinking the whole time yesterday. So what will happen today? There is HCl which is being produced in the stomach. It will keep on burning your intestine and the membranes and stuff. You will end up developing what we call ulcers. After developing ulcers, you know, ulcers can predispose you to getting CA or something. What will you have gotten all yourself into? Okay? So you develop so many complications just because you indulge yourself in drinking. So guys, stop drinking. Another thing we'll like to talk about. When you grow old, you end up it's like your cells starts to depreciate. Like now, the way I am right now, my bone cells are not the same like when how I was 5 years ago, right? So it depends. It means if I'm indulging myself in alcohol today, if I'm indulging myself in alcohol today, it means even tomorrow, my immunity will have depreciated. My blood vessels will have gotten something we call plaques, accumulation of plaques, because alcohol hardens your blood vessels. You end up developing hypertension. You end up developing kidney failures. You end up with multiple organ failures. So why do you need to drink? Just stop. Because especially when you grow old, as you grow old, your systems tend to shut down. So you can imagine now you're aggravating the shutdown of the systems with alcohol consumption, right? So guys, stop it. Those are just the kind of problems that you just take yourselves. What are 4 types of alcoholics? Social drinkers. To date, nearly all the research on drinking motives has been done on teens and young adults. Me, I'm a young adult. Me, actually not. I'm not a young adult. I'm still a teenager. I'm a teenager. Who said I'm old? You. I'm a teenager. So you can imagine me as a teenager, the teenager I am, I go to a place maybe whereby we are having some funkies. They normally call them funkies. Anyway, guys, I'm joking. Get me right. We go to a funky and then people are just enjoying something. Then I end up enjoying as well. Then kidogo kidogo I realized, oh, kumbe when you onja, this is how you feel nice. So the following day I'll start stealing money from my parents, or even I'll start those weird behaviors because I really want money to drink. You know, it is peer pressure. Oh, that was just a social drinking. My lips are even dry. Hmm? Drinking to conform, drinking for enhancement, for you to feel like you're in that level. Unaenda pahali unapatana na wasee, they are drinkers, so you feel like you need to fit the standards. Drinking to cope with losses. Like guys, me most of the times I've drank alcohol. I was drinking to cope, and it's because I was finding myself in situations that are compromising my mental status. I've lost my favorite brothers. I feel like I just want to follow them. My things are not working out for me. I don't even know who I am. I just drink to cope with the situation. I'm at work today. I've worked 2 days, 3 days, but I have offs. I have my leave off. I have my time off from work. So what do I do with my life? Just indulge in drinking. Because I just want to forget. If I'm not occupied with work, I just want to be occupied with something. So I find myself, the only thing I can do is drink and forget what was going on with my life. Okay? Then, what do you do to prevent alcoholism? We as a country increase the taxes on alcohol. I think you've seen it so often, like people are complaining, why is mafuta being increased? Mbona pombe haipandishi taxes? If we really want to curb on drinking, I think we can increase alcohol taxes. We can also regulate alcohol outlet density. You've seen people fighting, like you find that chiefs are fighting those alcohol dens in the villages, that kind of a thing. Yeah? So if that is also one way to prevent alcoholism, especially in central area, you find that people drink too much and then they neglect their duties as fathers, they neglect their duties as parents, they neglect their duties as mothers, because even women drink, I've told you guys. So you find that if we regulate those alcohol outlet density, it's easier. You'll find like a place like Nairobi West, it has so many spots for drinking, yeah? You just come out of the house like this and you find this is a alcohol drinking, whatever. You find this is another one. I mean, the alcohol drinking spots are many than churches in that area. So if you try to reduce and curb, I mean, it will prevent alcoholism. Commercial host, drum shop liability laws maintain or limit days of hours of sale. Like during that curfew time, you remember that curfew time when people were being told there's a lockdown, kuna curfew kutoka 7 p.m. mpaka 10 p.m. That is the only time you can sell. If it's alcohol, that's the only time you can sell. Kuanzia 11 p.m. mfunge mwende nyumbani. So unless you want to carry it as a takeaway, of course you can maybe right? So what are these 10 negative effects of alcohol? We've already talked about them. We've said there is brain deterioration. Heavy drinking can lead to brain damage and memory loss. You normally get amnesia. You wake up the following day, you have selective amnesia. You don't even know what happened yesterday. People are telling you this is what happened. And then you're like, really? No. Mouth decay. Yeah, no, but mtu mdomo. I hope sija decay. Mouth decay, my friend. You find that those people, they don't even have time to clean themselves. They don't have time for hygiene. So mdomo anafungua, my God, you're like, filth. Yo, lung dysfunctions, muscle atrophy, eye disorders, heart issues, liver damage, and stomach irritation. We've talked about all that, right? What does 40 years of drinking does to your body? 40 years. How many years have you been drinking? Drinking too much alcohol over a long period of time can lead to some kinds of cancer, liver damage, immune system disorders, and brain damage. Worsen some health conditions such as osteoporosis, that is breakdown of your bones, diabetes, high blood pressure, stroke, ulcers, memory loss, and mood disorders. Why did I decide to talk about this thing today? Because I felt it's important. It all starts with you. It all begins with you. However much you feel like there are so many things that you're going through, and those things are making you lose your sanity. They're making you lose your sanity, and they just like make you feel that this is the right thing for me to do. You feel like you're losing your sanity, and the only thing you need to do right now is just to get drunk. There are things you can seek medical help, you can seek treatment, you can seek help and stuff. Reach out to people before it gets too late. Treatment involves counseling by a healthcare provider, a healthcare professional, that's a HCP. A detoxification program in a hospital or medical facility is an option for those who need assistance. Medications are available that reduces the desire to drink. Okay? There is also a medical procedure that we call detoxifying. You go to a hospital, and you're given Fabrinex 1 and 2, just vitamin, the ascorbic acids. So they take off the toxins from the body, like presenting with any evidence of chronic alcohol misuse and any of the following symptoms. That is liver function test result indicative of compromised liver. You're given Fabrinex because they're just vitamins. Let's go back to the next slide. Therapy is also another thing. We've said the first treatment can be counseling, and then you do medical procedure like detoxifying. And then remember, when you're detoxifying these patients, you also have to monitor their liver function tests, and it's important for them to get Fabrinex 1 and 2 because just a combination of vitamins, vitamin C and D, right? The other one could be therapy, support group therapy, cognitive behavioral therapy, aversion therapy, family therapy, behavioral therapy, psychotherapy, group psychotherapy, all those kind of therapies that you talk about to assist this person who is fighting alcoholism. Do not laugh at them, my friends. Especially if you have a colleague. Me, I have colleagues who have this issue of alcoholism. Guys, if you have somebody at work, do not laugh at them, do not judge them because you are a medic and you know what happens with alcoholism. They start with something small, either peer pressure, then they end up with alcoholism. Before you know it, they have committed suicide, they have burnt themselves in the house.